That could be. Philadelphia so far are not overwhelmed with COVID-19 patients. That could be coming. One model says that there could be a surge in early May. Health reporter Stephanie Stahl is in a different part of our studio today with an update on one Philadelphia hospital system. Steph?
That's right, Jessica. As we've been saying, hospitals have postponed elective surgeries and moved out as many patients as possible, making room for an expected increase in coronavirus patients. These are stressful times for medical staffs on the front lines. At Jefferson Health, there are lighter moments mixed in with the difficult ones.
Through a storm door, this is how one Jefferson Health Emergency Department nurse says goodnight to her kids who are staying with their grandparents.
We're all anxious. We're all fearful. Our employees really are on the front line of this response and are incredibly dedicated to the work that they do.
Jeff Doucette, the chief nursing officer at Jefferson Health, says the drive-through testing sites have helped reduce patient volume in the emergency department. But they're ready for an onslaught of coronavirus patients, hoping they don't get what's happening in New York and other parts of the country where doctors and nurses are overwhelmed and desperate.
Call us heroes, but we have families too. And all the nurses are so scared. We don't want to be scared.
I've cried many days. I haven't seen my children in 13 days.
The toll that this takes on healthcare providers is significant.
Hoping to ease the emotional burden on staff and patients, there are lighter moments with pictures and postings. All in this together, 6 feet apart, and a group note that reads, "If you want to change the world, trust us, stay home."
We certainly hope that by citizens in Philadelphia following the guidelines of officials and staying home, that we will not see surges.
The only surge so far has been at the drive-through testing sites. From one Jefferson group doing outside testing, a moment to help calm fears.
The work that we do is incredibly serious work, but that does not mean that you can't have a sense of humor about it or share laughs. It's a great coping strategy.
Well-deserved lighter moment there. Now, all the nurses and doctors I talked to say they really appreciate the outpouring of support they have received. But the best thing they say you can do to support them right now? Stay home. Coming up at 5, my Skype interview with the chairman of Johnson & Johnson about a vaccine for COVID-19 that they're hoping to have available early next year. Also, what they're doing to help with shortages of Tylenol and hand sanitizer.